Greetings, I'm Dr. Ashutosh and now we are going to discuss nutritional dermatosis. So there are stages of nutritional deficiency syndrome. First stage is where intake falls below the daily requirement, but reserves maintain normal blood levels. In second, the blood levels decrease and the patient is asymptomatic. In the third stage, the patients start to show clinical signs and symptoms. The cause of deficiency may be due to decreased intake or increased requirement. Decreased intake may be due to poverty, ignorance, low diet, dietary disorders like anorexia nervosa, crash dieting, or increased requirements during any stress, fever, hyperthyroidism, lactation, pregnancy, or during growth. So stages of nutritional deficiency: decreased absorption and utilization. There are several factors to it: trauma, dietary factors, GI factor, renal factor, infections like parasitic bacterial infections, miscellaneous like collagen vascular diseases, HIV, etc. Now, nutritional deficiencies can be of either of fat-soluble vitamins A, D, E, K, water-soluble vitamins B complex, niacin, pantothenic acid, biotin, vitamin C, minerals, trace elements like zinc and iron, essential fatty acids, or protein energy malnutrition. The important point is water-soluble vitamins are not stored in body. Excessive consumption leads to no toxicity, whereas fat-soluble vitamins A, D, E, K are stored in liver, so excessive consumption might lead to toxicity also. Now, vitamin A, retinol deficiency. Rich sources are animal fats, fish, liver, oils, milk, butter, eggs, liver, kidney. And provitamin A or beta carotene is present in green and yellow parts of plants like spinach, drumsticks, spring onions, cabbage, pumpkins, carrots, tomatoes, fruits like mango and papaya. Clinical features include skin manifestations. In infants, there is extensive xerosis. In adults, there is follicular hyperkeratosis. Sites are extensors. They might spread to shoulder, face, chest, abdomen, back, buttocks. So this is one example in pictorial form of follicular hyperkeratosis. Such skin is also called toad skin or phrenoderma, where there is mild follicular hyperkeratosis in limited area of distribution, mainly on extensors. Mild deficiencies: vitamin A, E, B complex, C, and essential fatty acids can coexist with each other. In eyes, might lead to nyctalopia or hemeralopia, xerophthalmia, conjunctival xerosis, bite spot. This is all the sequence. First there is conjunctival xerosis, then it might lead to bite spot, then xerosis, ulcerations, keratomalacia, thiasis by scarring, and even blindness. So treatment is essential. Prophylactic treatment is also given. Vitamin A 2 lakh international units every 6 months to preschool children. Good quality protein diet and vitamins, and educating the local community, especially the parents. Now, dose of 1 to 3 lakh international units of vitamin A for 1 to 3 days. Stop if there is any headache. Supplement with B complex vitamins and essential fatty acids. Diet should include eggs, milk, butter, green leafy vegetables. Treatment of underlying causes essential. Now, vitamin D. Vitamin D is a group of anti-rickety sterol derivatives considered as a hormone. So its synthesis takes place in various places: skin, liver, and kidney. So skin has a key role in synthesizing vitamin D. So the source of vitamin D in animals and dairy products is mainly eggs, liver, butter, cod liver oil. And the most developed form of vitamin D is 1,25 dihydroxy cholecalciferol, which is called calcitriol. There is 3 alcohols, so it's triol, which forms by going maturation in various places like human skin, liver, and kidneys. So in clinical feature and treatment, in children it might cause rickets or tetany. In adults, osteomalacia, vitamin D dependent rickets with no skin lesion, and vitamin D type 2 resistant rickets with progressive alopecia. Treatment is good exposure to light, and in rickets 5,000 international oral units vitamin D for 3 to 5 weeks. Normal daily requirement is 400 international units. Now, B complex vitamins. Mostly combined deficiencies occurs along with zinc and essential fatty acids. First, B1, which is thymine or anurine. Sources are richest sources: yeast, unmilled cereals and pulses and nuts also have ample amounts. So its deficiency causes beriberi, which is of two types: dry and wet. So dry includes peripheral neurological syndrome, atrophic skin, red burning tongue, and a Korsakoff psychosis, Wernicke's encephalopathy. Wet beriberi has high output cardiac failure. Skin is warm before CCF and cold edematous crackled later on. Diagnosis is by checking the serum levels. Treatment of beriberi is 10 to 100 milligrams per day. In severe deficiency, add manganese because it corrects the thiamine resistance. B complex vitamins are supplemented. Local application of zinc oxide is done on the cracked skin. Now, riboflavin or vitamin B2 deficiencies. It's also known as oro-oculogenital syndrome, its deficiency. The sources of riboflavin are milk products, eggs, liver, cereal, pulses, green leafy vegetables. Deficiency of B2 affects metabolism of free fatty acids, tryptophan, and folic acid. Clinical features are seen 3 to 5 months after inadequate diet. It is also known as pellagra, sign pellagra. Oral manifestations are angular stomatitis, chelosis, glossitis, magenta colored tongue, atrophic filiform papillae, and enlarged fungiform papillae are also seen on tongue. Clinical features: skin manifestations, seborrheic dermatitis like rash is seen, dysesthesia is seen, and dysriboflavinosis, which is dyskeratotic follicular papules with scaly erythema. Patchy alopecia on scalp is also seen. Now in genitals, there is patchy redness, fine powdery desquamation, and in later stages, lichenification also takes place. In severe cases, raw areas might form on the shaft of penis and inner thighs. We might confuse it with other venereological disorders. In eye, there is photophobia, lacrimation, blepharospasm, and conjunctivitis. In CNS, psychomotor, intellectual development impairment in children. Again, diagnosis is by checking the levels in the serum. Treatment for infants is 1 to 3 mg and adult is 10 to 30 mg. Now B3, nicotinic acid, nicotinamide, and niacin. So its deficiency causes pellagra. Italian word for pellagra, Italian word pellagra is made up of two words. Pelle means skin and agra means rough skin. So first described in 1935 by Castle in Spain, niacin includes both nicotinic and niacinamide. Niacinamide is the active form which is converted to coenzymes like NAD and NADP. It plays a vital role in cellular metabolism. So this is how it appears: erythematous rash with or scaling on face, neck, and on the dorsum of hands, mainly on the sun exposed areas. Sources are meat, fish, egg, milk, cheese, cereal, grains, legumes, tea, and coffee. Endogenous production also takes place. 60 milligrams of tryptophan is required to form 1 milligram of niacin. This much we should take. Now the etiology is people who have a staple diet of maize and jowar have pellagra often. Maize because it's a poor source of nicotinic acid and tryptophan, and jowar because it has high content of leucine, and leucine creates an imbalance in the functioning of NAD. So it inhibits the functioning of NAD. Chronic alcoholics because of unbalanced diet, and malabsorption because since everything is getting absorbed in lesser quantities, it would lead to pellagra or B3 deficiency as well. Clinical features: there are famously 4 Ds of pellagra, which is dermatitis, dementia, diarrhea, and subsequently death also. And prodrome is which precedes the which is in the initial stages of the disease is weakness and fatigue. Now the clinical features: skin with it is mainly present on the photo exposed area. We have discussed, we have seen the pictures of it. And peregrine nose, which is dull erythema, butterfly rashes with scaling on the bridge of the nose. Cass's necklace is present on the neck. Cravat is when the anterior continuations of the necklace, if it continues on the to the anterior part of the chest, it is called a cravat. And scrotal edema is also present in this. Symmetrical lesions, clear line of demarcation. That is a distinct and a distinguishing factor of erythema on scrotum caused by pellagra. In mucous membrane angular stomatitis, cheilitis, scarlet glossitis, tongue is red, smooth and atrophic. Of filiform papilla is also seen. In GIT, there is anorexia, nausea, vomiting, abdominal pain, diarrhea, and CNS depression and psychosis. For treatment, 300 to 500 milligrams of niacinamide orally or intramuscularly divided doses is preferred. Supplement with B complex as well. Animal proteins like egg and milk. Balanced diet should be promoted and asked to reduce alcohol consumption. Now, pyridoxine or B6 vitamin deficiency. It is mainly present in liver, egg yolk, and meat. Vegetable sources are pulses, cereal, peas, and soybeans. Pyridoxine deficiency occurs during administration of drugs like isoniazid, which is given in AKT, hydralazine, cyclosporin, penicillamine. Clinical features in children includes convulsion and anemia, and in adults, seborrheic dermatitis like rash, cheilitis, angular stomatitis, glossitis, peripheral neuritis. There is an entity called as Chinese restaurant syndrome as well. So Chinese restaurant syndrome, because Chinese restaurant uses a lot of MSG, which is monosodium glutamate. And in people who have inability to metabolize MSG, it causes headache, sensation of pressure on the chest, palpitation, feeling of warmth, tingling, and numbness. Now diagnosis, again checking levels, and treatment. Therapeutic treatment dose is 30 to 100 milligram per day orally. B12 deficiencies, cyanocobalamin or cobalamin. Sources are liver, kidney, heart. Heart is the richest source. Other sources are vegetables, meat, fish, cheese, eggs, fruits, legumes. Vegetables in fruits does not contain enough, and whatever content they have, it is because if they are contaminated with bacteria which contain cyanocobalamin. So mainly animal sources. B12 is synthesized in colon, and it has less availability, so we have to take it in the diet. So this is the appearance of hyperpigmentation on the dorsum of hands. Cause of deficiency is strict vegetarian diet, gastric atrophy, parasitic infestation, malabsorption, elderly or chronic alcoholism. Clinical features: symmetrical generalized hyperpigmentation, grayish brown, and mucous membrane hyperpigmentation, cheilitis, glossitis. Beefy red tongue is seen. Pigmentation streaks in nails, premature graying and acanthitis in hair. Other manifestations are megaloblastic pernicious anemia, peripheral neuritis, and poor memory. Diagnosis is by checking the serum level, Schilling test, bone marrow examination, and hemogram. Treatment dose is 1 mg per week for 1 month, and then 1 mg per month thereafter. And in pernicious anemia, you have to give continuous treatment. Along with it, one should also give folic acid 1 to 5 milligram as well. Now folic acid, vitamin B9 or pteroyl glutamic acid or folicin. Chief sources are liver, meat, green leafy vegetables, milk. Produced by colonic bacteria, which is an inadequate amount. Folic acid and vitamin B12 are interdependent, therefore the deficiencies occur simultaneously. And folic acid in presence of vitamin C is converted into folinic acid, which is the active form. Now clinical features: in skin, diffuse hyperpigmentation in mucous membrane, glossitis, superficial erosion, cheilitis. Others like megaloblastic anemia. Diagnostic test: the levels, if they are low, Treatment is therapeutic dose is 1 to 5 milligram per day. Also correct vitamin B12 deficiency, because several other deficiencies coexist with each other. So one should correct all of them at the same time. One should not just pick and choose and correct one at a time. Okay. Now scurvy is caused by ascorbic acid deficiency. We all know ascorbic acid is vitamin C, which is very important, present in fresh fruits, orange, grape, lemons, amla, fresh vegetables, green leafy vegetables, potato, cabbages, and function is role in collagen and ground substance formation, wound healing, immune response, and required for iron absorption. Cause can be diet poor in vitamin C, GI disease, malnutrition, and in cigarette smokers. Features are follicular hyperkeratosis is the earliest change. Coarse through hair or swan neck deformity in hair is due to reduced disulfide bond in hair. Perifollicular hemorrhages in upper arms, back, shin, trunk, thighs, petechies, woody edema in legs, delayed wound healing. In oral cavity, hemorrhagic gingivitis and spongy gums are seen, loosened teeth, foul odor, hematuria, epistaxis, melena, excessive crying, and pseudoparalysis, scorbutic rosary in infants. Therapeutic doses 100 to 300 milligram per day. Now, mineral and trace elements. Zinc is very important amongst them. It is a metal motif and important and cofactor for several enzymes in several of the processes occurring in the body. Role of in immunological functions and wound healing is essential, and the sources rich in zinc are shellfish, legumes, nuts, whole grains, green leafy vegetables. Zinc deficiency, if it's genetic, it is presented to us by acrodermatitis enteropathica at very early age, and acquired zinc deficiency is an acquired deficiency. It can occur anyhow. Now, acrodermatitis enteropathica transmitted by autosomal recessive trait. So it is autosomal recessive, first discovered by Denbolt and Class in 1943. Etiology is due to deficient zinc binding protein called as zinc ligand binding. Clinical features: Ehrlichia, early signs, angulostomatitis, glossitis, perioral and periorificial rash is seen, vesiculobular pustular lesions. It usually occurs when mother starts weaning the milk, or if the baby is top fed. It occurs usually after birth, and it might lead to alopecia, paronychia, photophobia in the eye, diarrhea, growth failure, emotional and mental disturbances. Diagnosis by checking the levels. Treatment is oral zinc 2 milligram per kg per day for 1 to 2 weeks. 30 to 55 milligram of elemental zinc for 1 to 2 weeks. So 220 milligram of zinc sulfate is equal to 55 milligram of elemental zinc. So that is the equivalent. That is why the odd number of 55 here. Hereditary type requires lifelong treatment. So if there is deficiency of zinc, which is of hereditary type, which is acrodermatitis enteropathica, lifelong treatment is required. Now, iron deficiency present in green leafy vegetables. Iron is enough in pulses, meat products, vitamin C rich foods improve the absorption, and tea and tamarind inhibit the absorption of iron. Clinical features include generalized pruritus, angulostomatitis, hypochromic microcytic anemia, Plummer-Wilson syndrome, hair loss as well. Now, treatment: ferrous sulfate or gluconate 300 milligram thrice daily. Treat the underlying causes like chronic blood loss, parasitic infestation, malaria. Supplemented it with vitamin C. Supplementation during pregnancy is also advised. Now, protein energy malnutrition. It's protein, energy, malnutrition, and it is the most common form of malnutrition in our country. It occurs mainly at the age of 1 to 3 years, commonly seen during weaning off and post-weaning period. Marasmus is when patient with 60% of the expected body weight without edema. So marasmus is without edema. Kwashiorkor, patient who weighs 60 to 80% of expected body weight for the age. So the weight is 60 to 80%, but one should not confuse it. There is a severe protein malnutrition with relation to carbohydrate excess. And edema is also present. So marasmus, some clinical features: dry, inelastic, wrinkled skin, follicular hyperkeratosis, slow and lusterless hair. Lanugo might be seen. Nails are fissured. Facies is monkey facies, facies where the fat pad of the cheek is gone or diminished. Child is alert and irritated. In kwashiorkor, clinical features are skin, uh, flaky paint or crazy pavement dermatosis is seen. Enamel paint dermatosis. Site is on the pressure site. See, this is the picture. Now, other clinical features are also there. So, sparse, thin, brittle, easy pluckable hairs. Flag sign is seen. Broomstick appearance of eyelashes. The dyschromotrichia is also seen, where golden, blonde, or rust colored hair is seen. So the boy looks like a red boy. Treatment is high protein, high caloric diet, topical zinc paste or zinc supplement. Correct. Other associated deficiencies, as they all most of the times occur in unison. Treatment of infection and infestation should be done. Thank you. I hope you have understood the lecture. Thank you.